Hey, Dr. Augustine coming to you today, speaking to you about symptoms that you may be experiencing, such as bloating. Have you ever had any bloating or stomach pain where you ate a little bit of food and all of a sudden you feel like your stomach is, 6 feet wide? Or you might have some nausea. Nausea is another real common symptom. And what I'm going to do is I'm going to compile some symptoms for you, and then I want to tell you why. This has come up a bunch this week with a bunch of patients, so I wanted to bring it to the forefront because the only solution medically is surgery, which isn't good. So bloating, nausea, where you just don't feel right. Also, your mood can drop considerably. You can have pain. Matter of fact, this type of pain is supposedly worse than having a baby. That's pretty incredible. We don't ever want to have that kind of pain. So this is gallbladder dysfunction. It's extremely common. The causes that are behind it are the following: eating processed foods, eating too many carbohydrates in our diet, drinking coffee. The one thing about coffee that's problematic is that it can thicken your bile. And gallbladder, let me describe what your gallbladder is and where it's at and what it does for you. Your gallbladder is about in the midsection, right about here, right across here is where you can experience the symptoms. And it's on the right side, underneath your rib cage on the right side, right up in there. Okay? And having pain there, having bloating, having nausea can be indicators of gallbladder dysfunction. Very, very common. Now, your gallbladder is a little tiny sac of bile, and bile is what your liver makes. Your bile is made by your liver, and it helps you to detoxify your body. Basically, your liver dumps in toxins out of your body into your bile. And the second thing for bile helps you to digest fats. So as soon as fat hits your tongue, neurologically it's telling your gallbladder to squeeze out some bile so that you can actually emulsify and digest and absorb that fat. Fat is essential fatty acids. Really important for you to digest and be able to absorb and use fats. Fats are protective, fats are anti-inflammatory, fats are critical and foundational piece of having good hormones. Your brain is over 60% fat. It's mostly fat, so you need fat. It's essential. So to be able to absorb it, you need good gallbladder function. Therefore, your gallbladder needs to work well. But if you drink lots of coffee and or have eaten processed foods and too many carbohydrates in your diet, guess what? You're going to have problems with your gallbladder. So what should you do? Classically, you could go to the emergency room because it can be so painful. Another common symptom is you can get sweats. You can get the shakes. You can get really nervous. You can get very, very anxious as a result of gallbladder dysfunction. So the number one way to treat it medically is always do surgery. And many times you'll go in and they'll do an ultrasound of your gallbladder and they won't find any gallbladder stones. But what an ultrasound won't pick up, it won't pick up mud, meaning just exactly what it sounds, meaning your gallbladder that has bile inside of it, which should be a liquid, instead turns to kind of a thick mud, and that doesn't show up necessarily on an ultrasound. And yet you can still have all the symptoms and problems associated with gallbladder problems. And they're saying, nope, it's not your gallbladder. And yet it can be, because your gallbladder can dump bile into your common bile duct and then out into your upper part of your small intestine called your duodenum to help you to digest those fats. Well, what if you get some bile that's stuck, some mud that's stuck into that common bile duct? This problem can get so bad that it can back up into your common bile duct and over in towards your pancreas and start to cause pancreatitis, which isn't fun at all. So what's the solution? What should you do with this problem? You should, number one, start to put into your diet beet juice powder. Yes, beets, the purple beets that you would normally eat. I don't recommend necessarily eating them because of the sugar content in your diet. I'm a big opponent of putting lots of carbohydrates in our diet. Don't get me wrong, they taste good, but it causes problems for us. Beet juice powder, however, has hardly any carbohydrates in it. So you put a teaspoon of beet juice powder in about 3 to 4 ounces of water, mix it up, boom, drink that. Very pleasant taste, slightly sweet, not a problem. And I would do that twice a day because what beet juice powder does is it thins out your bile, makes your bile flow better. Secondly, beet juice powder improves and increases your nitric oxide production. Excuse me, nitric oxide is very protectant of your cardiovascular tissue and helps your cardiovascular and muscular performance. So it improves nitric oxide. It helps certainly your gallbladder to start to work better. In some cases, a person might need to take a gallbladder supplement, and the gallbladder supplement can have anything in it from milk thistle to beet juice powder. It can actually have ox bile. Bile can actually take some of the stress off of your gallbladder and allow it to calm down and relax so you can feel much better. So I would certainly recommend either a gallbladder supplement and or some beet juice powder additionally to start to calm down your gallbladder. So please try this. You could always go for surgery, but it's considered a major surgery to remove your gallbladder. So I hope this helps. This is Dr. Augustine from Head to Wellness. If you have any questions, please leave them below. Let me know. I'd love to help you out with this. And again, have a great day.